Alrighty, we're going to start with the introductions of the Africa Hub. If you're new here, this is the Nursing Now Challenge Africa Hub. The Nursing Now Challenge is an organization that is geared towards raising the profile and status of nursing all across the globe. And we have a challenges committee that drives this agenda in the different regions. So we have Africa, Americas, Eastern Mediterranean, and all the other regions as classified by the WHO, and this is the Africa Hub. And today we are going to be discussing the State of the World Nursing Report. As you may be aware, the second report is going to be launched this year during the International Nurses Day, and this is very, very exciting for all of us. And I think the previous report had been launched in 2021. So it's going to be very exciting to see how our countries and how our leaders have been able to carry forward those priorities that had been stated. And the discussion today is going to be focused on how we as nurses in Africa, at whatever level of healthcare we are at, how we can use this as a tool to drive change, to drive positive impact for sure, and how we can use it to advocate for ourselves even as we look to the future. And once again, welcome. My name is Zipporah Iregi. I'm one of the leaders of the Africa Region Hub. And I am a registered nurse from Kenya, though I'm currently studying in Edinburgh, doing my master's in nursing studies. And I'm really, really passionate about seeing early career nurses like myself getting the opportunities to lead and to drive this conversation as we look forward to build a better future for health, where we can achieve universal health coverage. Yeah, and that is me. I'm going to invite Mohammed and Maureen to introduce themselves, and then we will continue. Maureen, over to you.
Thank you so much. Good afternoon, everyone. So I am Dr. Maureen Musi. I'm an advanced midwife specialist and also a senior lecturer at the University of Pretoria. So I'm currently, as Zipporah indicated, I'm one of the Africa Hub's leads for the Nursing Now Global Challenge, the committee, which I'm from South Africa. So I'm representing South Africa. And wow, so yeah, thank you so much. I'm also, passionate about anything that concerns nursing, early career nurses, midwifery. So that's my specialty, the mother and child health. Thank you so much.
Thank you, Maureen. I was just making sure I have my Zoom background as well. Thank you for introducing yourself, Mohammed. Over to you.
Well, thank you so much, Zipporah. My name is Mohammed Mudbir. I'm a registered nurse from Sudan, currently doing my Master's of Public Health at University in Sweden. So I'm also one of the co-chairs of the Africa Regional Hub Challenges Committee from the Nursing Now Challenge. Particularly, I'm passionate about nursing leadership, and the role of nurses in the public health sector. So nice to meet all of you, and looking forward to our wonderful conversation today. Over to you, Zipporah.
Thank you so much, Mohammed. Yeah, so we are the ones who are leading the Africa region at the moment, and this is the first of many events to come as we engage with one another across the continent and share our experiences, and even just get to know one another and even build this global network moving forward. And we are so excited to have you here. Like I said, just please introduce yourself in the chat. I see a lot of people messages. Let us know your name, where you're from. And if you're not part of the Challengers Committee, I hope that after this meeting, you're going to consider joining us, even as we continue to advocate for change in Africa. And so at this very second, I would like to introduce our speaker, Mr. Champion. He is the technical lead of health workforce education at the WHO Afro region, and it's such an honor to have him here. And he's going to be sharing a few aspects of how we can engage with the State of the World Nursing Report moving forward, even as we await its launch in May. So karibu sana, Professor Champion.
Please confirm if you can see my slides.
Yes, we can.
You can. Right. And you can hear me loud and clear.
Yes, we can hear you loud and clear.
Excellent. All right. Just trying to sort out a few things. Just a moment. All right. Okay, so I just wanted to say good afternoon to everybody and greetings to all of you, especially the colleagues from the Nursing Now Challenge, the Africa Hub. I first want to express my deepest appreciation for this invitation, just to have a chat with you and a discussion around the upcoming launch of the State of the World Nursing Report. As mentioned, I'm Professor Champion Nyoni. I'm from the WHO based at the regional office in Brazzaville, Congo. So I lead health workforce education and training, and recently issues also related to nursing and professional practice have also fallen into my portfolio. So the focus of today's discussion is about the upcoming State of the World Nursing Report, which is set to be launched on International Nurses Day on the 12th of May, 2025. And like the Zulu warriors that are dancing there and playing their drums, we're all excited and ready to see the launch and wondering in anticipation of what really is part of this report, what's going to be contained in the report. And like I said to the organizers, it's not my job to tackle the report or preempt what the report is about, but I think the focus of the session is just to reflect on what has the potential of the report, its launch, what it has got to do with you, assuming that everybody who's in this call is an early career researcher or early career nurse, or interested in the whole positionalities of early career nurses, particularly in the growth within the African region. So this keynote is specifically talking to you about, as the next generation of nursing leadership, how can we think and how can we strategically look at this report and influence our practice moving forward? So to start this conversation, I wanted to position this argument from a space where not all the time everybody on board understands what some people can consider basic. For example, when we say this, the State of the World Nursing Report, some people might have said, we're really not so sure what it is, but we just want to join in and understand the process or what this is all about. And when it was released, the first one in 2020, some of you might have still been at school finishing your degrees, and you were busy with your final assessments. You had no time to understand what are the numbers, what is the state of what. And it was during COVID, what you wanted to do was perhaps finish your degree and diploma and run to get a job. So I wanted to start this conversation by starting with this understanding of what is the State of the Nursing Report, what is its purpose, and when was the first one launched. So the State of the World Nursing Report is a joint initiative of the World Health Organization, the International Council of Nurses, and the Nursing Now campaign, which provides a comprehensive analysis of the global nursing workforce. So it highlights the vital roles of nurses in healthcare, the advocating for investment in education, jobs, and issues around leadership. So the report often provides data that has been captured from almost 191 countries across the world and focusing on the roles of nurses in their various contexts. So what you'd often pick in the report is the various gaps in the nursing workforce, priority areas for investment in nursing workforce, the need for increase in investing, particularly looking at nursing education, jobs for nurses, and leadership in nurses. And issues, sometimes you get a full discussion on issues around health labor markets and then policy levers, providing some of these policy options to strengthen, particularly within the nursing workforce. So there's often at the end a call for action, some sort of specific direction which governments and partners may take in terms of strengthening and supporting the nursing workforce and around those issues we mentioned in nursing education and jobs for nursing in leadership, and perhaps how to tackle the often discussed global shortage of nursing. And so the first report was published in 2020, and then we are really eagerly awaiting for the next report, which is going to be published, I think, in a month's time. But then I thought having this sort of background of what this report is, just to look at what we peaked last year, specifically for the African region. There were several issues that were highlighted that I think were essential for us to ponder on, think about, and look at how do they impact us now. And when you get to see the report next month, you need to perhaps think, has there been a difference? Has there been any change? And what are we going to be looking for in the next 5 years with the existence of the 2025 report? So there were issues that were reported around nurse workforce composition and distribution, issues around gender and age demographics, issues of training and education capacity, and issues specifically on challenges and recommendations. Regarding nursing workforce composition and distribution, the African region's health workforce comprised almost 3.6 million individuals, and that was at that time. And then we have nurses that were reported to be about 37% of this entire total, which makes them the largest single group of health professionals within the particular region. And the density of both the nurses, the physicians, and midwives in the region was estimated at 1.55 per 1,000. And notably, some countries like Seychelles, Namibia, Mauritius, and South Africa have actually densities that were exceeding the WHO Sustainable Development Goal threshold of 4.45 per 1,000 population. So they were sort of inching closer to this threshold that's necessary for achieving universal health coverage. Regarding the gender and age demographics, interestingly, the nursing workforce in Africa exhibits a higher proportion of male nurses compared to other regions in the globe. For instance, if you look specifically at Francophone Africa, countries such as Benin, Burkina Faso, and Cameroon, they were reported to have more male nurses than female nurses, which is quite a contrast from the global trends where there's always more females that are predominantly occupying nursing roles. And significantly, almost 89% of the nurses in the African region were below the age of 45, indicating a relatively young nursing workforce within the region. And if you look at the training and education capacity, we've seen an annual increase, or rather an increase in the output of nursing and midwifery graduates in the African region, from about 150,000 in 2018 to over 250,000 in 2022. That's more than a 70% rise in the number of graduates in nursing and midwifery. So this surge reflects enhanced educational capacities that are going on across the continent, and also we also attributed to improved counting, that the units specifically here at WHO have worked very well to make sure that there's more systematic counting of the workforce, specifically within education. But then it also reflected some challenges and recommendations that despite this positive trends in increase in education and youthful workforce, there were still challenges that were sort of unique or specific to Africa, such as the shortage, such as the uneven distribution of nurses and getting spaces where, you find more nurses in urban areas than rural areas, and specific types of nurses in rural areas than in urban areas. And there were calls for different approaches in terms of addressing the investments in education, job creation, in leadership, and also thinking more strategically in how nurses work collaboratively with other health professionals to make sure that there is attainment of universal health coverage. So as I was thinking in preparing for this session, I had to think about how do we put this together, because we don't have the report yet. We are trying to think about, as an early career nurse, what should be my role in looking at this report? What is my position in this report moving forward for the next 5 years as I position myself to be a nurse leader? I said, God, we're looking at this with excitement, but how best do we think about this? So I repositioned the argument, and I just tried to synthesize these 7 key areas that I think can lead into an interesting conversation, linking your role as an early career nurse as part of the Nursing Now Challenge in terms of transformatively engaging with the nursing, with the State of the World Nursing Report. The first point, remembering that you are the born and not necessarily a backup. They would touch on from data to destiny. Your stethoscope is your microphone. Being rooted and being radical. Workforce without borders, but with purpose. That this is not just a career, but a movement. And the numbers don't lie, but they don't heal either. It's you who does the process. So let's just unpack this a bit. So if you look at previously from the State of the World Nursing Report, they will show you, it always shows those numbers that, nurses will make up an X percentage of the global health workforce. And in Africa, the nurses are a larger number of the nurse. And this isn't just a statistic that you pick. And because we run statistics and we always cite statistics, this is actually a true revelation that nurses are not just an add-on to the health system. They are the health system. So it confirms what you already know from your experience, that nurses are the most present and most accessible health professionals, especially in our communities. And in most settings, I often write it in some of the papers I publish, that they're usually the first and only healthcare worker that a particular person, especially in communities where we all come from, may have access to. So despite their presence, many nurses remain under-recognized, underpaid, and excluded from leadership roles. This contradiction must end, and I think you guys are in the right position to argue this out very clearly. And seeing yourself as early career nurses is central to the health system in strengthening it, and not only just delivering care, but shaping how this care should look like. Perhaps thinking as a tagline, reframing your identity. You are essential, not optional. You are the system's spine and not its shadow. The next talk is about from data to destiny, and this is linking specifically to the structure of the report, that what you will find is hardcore data. It will tell you how many nurses are there. It will tell you where they work, their scope of practice, where the gaps are, what is going on. But this data is not just data. It's this data that should give us destiny, and it only becomes destiny when we are able to act on it. So the shortages, the imbalances, the skills gaps identified in the report are not just numbers. They are opportunities that are set for us to lead, for us to specialize in, and for us to innovate. In Africa, they say we need more nurses, yes, but it needs nurses with vision. Nurses will be able to take the data and drive it moving forward with solutions. So every chart in the report will point to someone making a difference, and that somebody could be you. So you're not just in the picture, we are holding the pen that will draw the future of where this nursing point is going to be. So looking at this 5 years later, we should sit in this very same webinar and ask ourselves, as the Nursing Now campaign, as part of the challenge, what did we do from the data that we learned from the State of the Nursing Report? This was my favorite, and I had a good time actually working on this diagram, and it was quite fascinating to see how, your stethoscope can actually be your microphone, in the sense that often we want to push that the nurses, because of the volume that we have, because of the part that we play in the system, we also have an ability to sit in the tables and be an influence in the tables. So as an early career nurse, you obviously bring fresh perspectives, untapped ideas, real-time insights from the front lines. Your voices are critical. So what you see happening on the front line compared to what some people see in air-conditioned offices somewhere in the 7th floor is totally different. So I think you need to think more cleverly in that you don't need to have a senior title to think about leading. Starting your ward, starting your clinic, starting your WhatsApp group to your peers. Leadership begins with confidence and clarity. Speak up for the patients, but also for policies. Think about safe staffing, fair working conditions, and educational reforms. If we don't speak up, no one will speak on our behalf. And if we don't speak, no one speaks on our behalf, systems remain the way they are. And 5 years later, we'll still be reporting the same problems, the same challenges, and the same statistics. So your stethoscope transform it, and make it your market. Often the report calls a whole lot about transformation of nursing education. Think about it in terms of competency-based education. Think about digital learning, improving clinical environments. And when we talk about this is your area. When we talk about education, it is often innate that we expect the nurse to always nurture the next nurse that comes into place. We have a whole saying that nurses, nurses eat their young. We are in the position to nurture the next people that are coming in. So we can't have the report calling for transformations in education and we expect, no, it's the university that will first need to change the curriculum and then it's the council that needs to approve it. The very same students that come and work under you, the very same people that come and work within your space, that is your opportunity to transform and change the curriculum. So in as much as you need to stay rooted in the reason why you became a nurse, the compassion, the service, the healing, but just pair this with boldness. Challenge these outdated models of care, challenge these outdated models of training, advocate for innovation, think mobile health, think community-first approaches, interprofessional collaboration. I mean, being radical doesn't mean, yes, you have to be reckless, but it means standing there, being courageous, being visionary, and being future-oriented. So keep your feet in your purpose, but your mind should be used to reimagine what is possible and actually strengthen where nursing is going. I like his hat, though. I think his hat has got something for us to learn. Okay. Also thinking about Workforce Without Borders, and one of the biggest challenges that we saw in the last report and that we're going to perhaps see in the coming report had to do with workforce mobility and this global demand for nursing that particularly spiked just after COVID. And then we saw a lot of our nurses having migrated from Africa to some spaces, usually in the UK, the US, Australia, and countries having nurses that have what we call a higher intention to migrate. So having done the surveys, you see country, I think with statistics from Zimbabwe, where we've got 44% of the nursing workforce with an intention to migrate. So thinking they want to go, having started the process and so forth. So we need to see this as a challenge, and we need to see how best can we strategically look at this as positioning your skills. Yes, it's important to realize that as African nurses, your skills are in demand. You produce good nurses who have got value in the world, but then also rethinking about how do we make sure that we are purpose-driven and that we do not compromise, collapse our own health systems within our spaces. Thinking more closely about building careers that also span our borders, balancing our own personal growth, our intention to leave, but with a collective responsibility. So ever you go, carry the health of Africa with you. So you don't just follow the opportunity and follow impact, but just let your purpose be your passport. So the State of the Nursing World report will call for stronger policy support, fairer work environments, investment in leadership. And this is not just technical issues, but this is positioning nursing as a movement of justice, where in hospitals, during pandemics, we keep the systems running. We make sure there's access to healthcare. When some people are staying home and deciding not to be part of things, we are on the ground, we are the foot soldiers, we are ensuring that there is justice. So the future of this movement is dependent on you. It's dependent on your voices, on choices, and your courage. So your work is not you're alone fighting alone, but you are part of a bigger, larger fight, a fight for dignity, a fight for equality, and a fight for health for all. So you're not just in a profession, you're part of the revolution, and carry the torch and carry this torch of pride, such that when we sit and we discuss what is the impact, it's not only you, but you remember that you are in a bigger space and you're working with a larger group of people that are converted like you. My next slide is talking about the numbers. Yes, the numbers don't lie. But at the same time, we shall never be slaves of the numbers. We cannot always be preaching about the shortage, always be preaching about this is not there, this is not happening. At the same time, the numbers don't make a difference. They don't heal, they don't care, they do not provide health. But you do. So the numbers give us clarity. Yes, it's important. They tell us the gaps, the strengths, the opportunities. But like I mentioned, you provide the care. So every statistic is a reflection of real people, of families, of communities, of people in need. You must see the humanity behind the graphs. So while every health system relies on policy, technology, and infrastructure, it is the human element of nursing, your knowledge, your compassion, your hands, that transforms those systems into healing. So not just saying this is the proportion, this is the number, but thinking about the people and the implication of what that number means and what your role becomes quite important. So the report may map the future, but you've got the potential to make meaning out of it. So bringing that data into life, when we say there is a shortage, what does it actually mean within your particular space? And always remember that technology may assist, but healing is always your main, and that's where you come in. The numbers matter, but you matter more. So as my final takeaway message is that to all of you as early career nurses, this is your moment. The State of the World Nursing Report is more than just a document. It is a call for action. It is a mirror showing where we've come from and a map pointing to where we must go. The future of nursing will not be written without your voice, without your energy, and without your courage. So stand up and be counted. Join the movement to amplify the report and what it stands for. Be part of the conversations shaping the transformation of healthcare. Don't wait to be invited. Take your seat on the table. Better yet, just help redesign the table to include a lot of your friends that we all sit in the table and we all speak in one voice. You are not just witnesses to change. You are the change. Be the ones who protect and shape the identity of nursing, not just in word, but in actions. Commit to excellence, insist on dignity, and champion professionalism. Work across professions, work with professions, work collaboratively, but with integrity and always let the distinct voice of nursing be heard in the room, not as an echo, but as a clear and a steady bell. The world needs nurses now more than ever, nurses that are competent, that are skilled, that are sharp, that are compassionate and courageous. So I encourage you to rise up, to speak loudly, and to speak boldly, because the next chapter of nursing should and will have your name on it. So make sure that name is written in ink and not in pencil, because we know what happens to what's written in pencil. Ladies and gentlemen, thank you very much for listening to my session, and I hope this resonated with some of you. Thank you.
Wow, Professor Champion, that was just wonderful, amazing, such powerful call of actions there. And I hope our listeners today and those who are in this meeting can actually have taken that to heart and move forward with that. I loved particularly the one where, we are the backbone, not the backup. I'm definitely going to be stealing that. And that presentation has just been very, very wonderful. And I want to invite Aisha at this moment to share her responses and her remarks. If you have any questions, just make sure you drop them for us in the chat. We're going to have some time to have further discussion and ask questions. Professor Aisha. I don't know if she's still with us.
I am here. My mouse, I lost my mouse on the screen.
No
yes, I mean, champion. I hope we were recording that, because that was absolutely awesome. I mean, It was so good. I am sure you have inspired so many people. And wow, that slide with all those 7 elements there, I thought, where did he get those from? They are so good. So first of all, thank you so much for being with us today. We actually met for the first time a couple of weeks ago, and I know you're new into role, but if that's your level of contribution, then I absolutely think we can do business. So we really appreciate your time. We appreciate your input to supporting, there you are, hi, to supporting the early career nurses in Africa. And what I think you bring, and many, as do many others, is this this idea of what others expect of this group that exists, this youth, these early career nurses. They are ready, they are waiting to take action. And what they need is more than just Nursing Now Challenge. They need many, many others to support, to show them the way, to encourage, to bring a different narrative, to bring a different perspective, because we know not one organisation or one person or one perspective is the answer here. There are many different lenses, there are many different layers, there is grassroots, there is the balcony view, there is so much to this that they need. And your presentation for me really encapsulated everything there so wonderfully well, so articulate and so thorough. And I'm sure everyone listening will be able to take something from what you said, a message, a key message for this call to action. And I absolutely think for me, the point is this idea that it is not coming to take you somewhere. You have to take yourself there. What you have to ask yourself, what are you waiting for? We as nurses need to ask that question, and you have permission. It is no longer the case of we have to wait for it. It is here, and there are people who want to support you, to facilitate. I mean, look at Champion. We reached out to James. He said, speak to Champion. We spoke to Champion. He was like, yes, I am up for this. His credentials are stellar. And we're going to think, well, how did he get there? So that's maybe another story for another time. The visualization of okay, what was your journey? What's your story? And here he is now today. And so there are individuals, there are people who want to support and want to guide and want to utilize the energy, the ideas that you have, the solution for nursing, to inspire others to join nursing and to actually see what nursing is going to look like in Africa and will look like and is looking like now. You know, you just need to look at the screen here. And yeah, I can't thank you enough. And I hope people who are here, what we need from you, I love this idea of when we have these groups together of thinking, okay, and Champion, I'm going to come back to you on this one, but what is the one takeaway? You talked about several things, but what is one piece of action that people who are here today must take away and do? And this is what we need. And Zipporah came and spoke with my master's students just recently in Edinburgh. She's back home because she's starting her data collection for her master's by research, and she's doing amazingly well. And she is just the most joyful student. She comes every time smiling. It is just so good and ready to learn. And if you've got any queries about research methods, she's your woman to speak to. Let me tell you, she's an expert now. But she came and spoke, and she had a slide of the first time she was saying to her student nurses, is this it? Is this it? This can't be it. I want to do more. And many of them were looking at her like, what do you mean, is this it? We've no idea. And so that did not put her off. She went and she had maybe, I think, about 6 people sitting on garden chairs in this gorgeous garden. And that was the group. And she didn't stop. She kept going. And then we see 6 months later, this group, there's about 40 of them now. And so she has done it. She has taken the action, not because someone told her, but because she already has connected with her purpose. and what is driving her, her values, her moral compass, what she connects with, what she needs to do. And that's how we want to be, particularly with Nursing Now Challenges. What is the thing we can't not do or stop ourselves from doing? It's in us. So let's do it. Let's unleash ourselves on the world with this report that's coming. This is it. This huge piece of work. People think, what? Seriously, they need to look at documents like this that come out. This is the data, this is the evidence, this is the tool that we can use to execute our action. So let's do that, familiarize ourselves, tell other people. We need to work collectively, we need to collaborate across different sectors, different groups, and we need to take action together. But Champion, if there is one key action point, what would you like to see people do?
I don't know if there's one. I do not know if there's one. But I think the starting point is actually remembering that you're not alone, you're part of a group. And that perhaps what you're going through is not necessarily the first time anyone has ever gone through. There's somebody downstream that has got a solution. So with this report coming, the point is, it's not a reflection of, oh God, this is how bad the situation is. The idea is this is the opportunity for us to showcase who we really are and what we're capable of doing. And so I think the point that would come more strongly for me is collaboration. How do we collaborate across borders, within our country, across borders, for us to say we are leading in this conversation? And I see one person in the chat that said something. I just want to just address it quickly because it's quite important to me, because it's a thing we face as early career nurses. We've got these massive ideas and we want to transform things. And there's always one barrier and another barrier and another barrier. And how do we use this opportunity to demonstrate that I'm part of a big group and we are making big changes? This is not just me going on, we have everybody else that's part of this movement. So I think collaboration in country, collaboration across the country is something that could be a good starting point. Thanks, Aisha.
Fantastic. That is it. Collaboration and networks. You know, those strategic networks that we build and build relationships. That is absolutely the fundamental element of everything we do, is respect each other, meet each other with kindness and generosity, build these trusting, authentic relationships, be clear on our purpose, and people will connect. They always do. Yes, we have numbers. Yes, we have, but we have to have a soul and something that people can connect with. And you're right. You can be part of this family that does exist. So absolutely. Thank you so much, Champion. Zippy, back to you. Sorry, I think I've probably skewed your agenda and time. I'm so sorry. Once I get started, you should just mute me. Seriously.
No, that was wonderful, Aisha, and I totally agree. Like you know, when you find your purpose and you run with this, you're fighting for your space on the table, you find your people. And like even with the Challengers Committee, I found my people, and they have been such an encouragement and such a source of joy, seeing as we are not alone and we are working together to change the status of health, not just in our countries but globally. So thank you very much. I'm being informed that Dr. Kari is here. Dr. Kathy, sorry. I don't know if she would like to say a quick hello to us. Dr. Kari McCarthy, if you're still with us.
Yes, hello. I wasn't planning on saying anything. I was just going to listen into the discussion. Hello and
Hi, Kari. What a great surprise. Sorry.
I'm just so pleased to listen. And it's great to hear the discussion, and I'll leave it to you all to discuss and with Champion, obviously. So thank you for this leadership from all the early career nurses on this topic.
Thank you. That was such a wonderful surprise. We are so encouraged that you're here. And I wanted also to note that for our members who have joined today, please note that Professor Champion, Aisha, and Dr. Kari as well were nurses and began as nurses and see where they are now. So there's still hope that you can start where you are, like Champion mentioned in his speech, with what you have, and you never know where that is going to lead a few months down the line. So I don't know if you have any questions. Mohammed, over to you.
Well, thank you so much, Bibi. Thank you so much, Professor Champion, for the wonderful slides that you have provided, and Provisor for the wonderful words that you mentioned. Really, I love how you are articulate how this like future of state of quality nursing report will impact our nursing profession in Africa, and how you are highlighting the 7 points that really I love it about the report. I think we had like so far 2 questions for you, Prof. Champion. The first question is how we are to do it to break the barriers and administrative bottlenecks, preventing nurses from acting as soon as possible, especially in Africa. You know what to do, ready to act, but there is some barriers and bottlenecks for early career nursing. So basically, how early years to act right now with the current situation in Africa?
Important question. It's a very important question and very valid. And I might not have all the answers, and I think the answers will definitely come from this group. But the thinking often one looks at, and that's often something that we might need to think more strategically, is that the concept of leadership is something that we need to reimagine, especially when it comes to change, because we often get this brilliant idea and we immediately want to engage the brilliant idea. But it's fundamental that you have an understanding of the context, to understand the powers, to understand the situation, and to understand the processes in which change happens. And that often is something that, you know, we just want things done immediately and we want this one. But having these administrative barriers and having these are part of a broader system that one needs to first have a thorough understanding of where the issues are, where the barriers are, and how do we actually engage the barriers before even thinking about innovating. Because sometimes there are barriers for some reason. They've been there for a while and there's a reason why they're there. We never know the reason. And they might actually not even be working against us. But I think there might be a situation where you need to put your innovation on the side and say, my process now is to engage with the barrier. How do I converse my matron on this? How do I sit with my in charge and say, this is quite important before we even think about the change, you know? So I think as you're engaging with the barriers, my experience has been a thorough conversation with what does my context look like? What does my system look like? Who has the power and who doesn't have the power? Who has the process? And how do I bring them to view what exactly I'm viewing before I build in this argument about the innovation or this thinking differently about it? And it doesn't at times take immediately, you know, you think, okay, we need to get it 5 days done, it's done. It may take a year, at times it can even take longer, but getting yourself grounded. We think this is important. We think this is valuable. If it means I need to convince the next 25 stakeholders to get it done, it might be the route or the path that you need to take. So a solution in one particular space might not necessarily apply in the next space. There are various issues that come in with specific to context. And I think groups like this become a fundamental space to then say, you know what, guys, how do I deal with this? There's this thing that's going on. We need to build in. This is what my context looks like. What strategies can I use to think about change? What strategies can I use to manage change? And what strategies can I use to sustain change? Because there's a whole cycle that comes in. And sometimes people, if they don't know you, they become very suspicious. Are you saying we're not doing our job very well? You know, you have only just been working for 2 days and I've been working in this institution for 500 years. You can't come and tell me that I've been doing this incorrectly. So there's all these issues that come in as part of the background that one needs to think about in terms of engaging change. And I think that's something that as a group, we might need to say, how do we strengthen our leadership capabilities, not only leading in terms of getting things done, but also navigating our complex contexts, which are socially, politically, linguistically different in putting this place. So yes, context.
Well, thanks so much, Cross Champions. This is like a very wonderful point to mention. Context matter, power must be understood, and change must be started in a slowly way. So now we will move on to our next question, which is related to research. The second question is, someone is asking about early career nurses are involved in clinical research, both as a postgraduate student and during workforce research. How this report incorporates nursing research as a priority in the upcoming State of Nursing report?
The previous State of Nursing report of 2020 did not have research or research output as a data collection point or as a data reporting point. So I'm unsure if it's been captured in the 2025 research, to reflect on, what's happening, what's being researched on, and what are the outputs and so in that space. Perhaps that could be something that could be incorporated in the next cycle to then look at, and again, coming from an organization like yours, what is important about research that should be captured and how should it be integrated in the State of World Nursing report, specifically with nursing research. And I think it's a very passionate area for so many people to say, we're doing a lot in Africa, we're doing a lot of nursing research in Africa. Is it being captured? Is it showing that this is research that's coming from Africa? And where is it actually published? What is it actually being crafted to solve? Are we getting any outputs that are coming in specifically from nursing research and not from research done by nurses for other fields, but research that's done by nurses in nursing about African nursing? So I think it could be a strong recommendation to look at maybe rethinking about these data collection points to then incorporate the role and the value of nursing research in Africa. Thanks, Norman.
All right, Champion, I think that's the whole question that we have. So over to you, Prof. Aisha.
Sorry.
Yes, just one little thing. Can you please go to the Nursing Now Challenge web page? I've put the link in the chat, and you will see our newly launched countdown clock. I'm very excited about it, for our countdown clock for State of the World's Nursing. Please go and have a look. If you're wondering when it's coming out, just keep going to the Nursing Now page and you will see our clock counting down. That was all. I just wanted a little plug for that. Thank you.
Thank you so much. There has been a lot of gold mines shared here today, and I, for one, am going to be going back to this recording to just sit with it and actually listen and reflect, and moving forward, make a decision on where do I start, how do I engage even as I continue in my efforts to advocate for early career nurses as myself. But before we let you go, I'd love to invite Dr. Maureen. She has some exciting news for all of us. Dr. Maureen, over to you.
Thank you so much. Wow. I really think that, from today's webinar, we are all excited. And thank you so much, Professor Champion. Thank you, Professor Aisha. So this is a reminder to all of us, whether you are a nurse working in the hospital, whether you are at the university, whether you are in government, whether you are in policy. So we all have a role to play. And as they indicated today, that, we all have to secure our place at the table. We're not going to get invitations, but we all really have something, a role to play. And thank you so much. I really, we enjoyed so much this, the webinar. I think as Zipporah indicated, all of us will be going back to the recording, the 7 actions that have been spoken about, so that we are all encouraged, as early career nurses, we all see hope, and we should be talking about, such conversations, the State of the World Nursing report. So I really think that we are all excited about the launch. Are we all excited? I think we are all excited. So the first news that we have is that on the 12th of May, so as part of the Africa Hub, the Nursing Now Challenges Committee, we are announcing that we will also be, having an online event on the day where we will be launching, where the World Health Organization will be launching the new State of World Nursing report. So from Africa as well, please be on the lookout, on our pages. I'm also going to announce the pages as well, so that you can have a look and participate, in that event. So on all of our platforms. So that is the one news that I have for you. The other news is that we have launched our social media pages for our Africa Hub. So please go have a look. So the first social media account that we've opened is Instagram. So you'll follow us at Africa _Hub. underscore N and C. I think if Mohammed, we have a QR code for that. You can also go to that on the, if you can look at the chat and also the link to the social media pages. So yeah, as he indicated, we have a page on Instagram. We also have a page on X, and we'll also be announcing other pages where we'll be also having the pages there. So be on the lookout for that. And in terms of the pages, we are calling on all members to engage with the content that is shared. Reach out to us. We need your ideas. Let's sit together. Let's share ideas as to, you know, what are the campaigns? What are the messages that we need to be sending out there? So let's collaborate. Let's think about ideas that we can showcase on our pages. So that's the other thing. And then the other thing is that if you are not a member of the Nursing Now Challenge, please, today we are calling you to join the Nursing Now Challenge. I think also Hannah has shared the link on the chat. Please do click on the link to become one of the members of the Nursing Now Challenge. Another thing is that, as I indicated, in celebration, so we're going to be having in celebration of IND, which is your International Nurses Day on the 12th of May. So that is where we're going to be launching the State of the World Nursing Report. So everyone, let us tune in, let us follow those pages and be on the lookout for more information on those pages. And just to reiterate the words from Professor Nyoni is that we are all essential and not optional. So today we are reminded that we are all essential and not optional. So please, we all have a role to play. So those were the things that I wanted to share from our side. So please do join us, be part of this, great opportunity. Thank you so much. Thank you.
Thank you so much, Dr. Maureen. We are excited to have you with us, representing the South. And as you've heard, exciting things are coming, not just for the Afro region, but also other regions in the Nursing Now Challenge. So be on the lookout on our website. We're also going to be sharing things on the socials. So please follow us, engage with the content. And if you do have ideas, we exist because of you. So feel free to reach out to us. And we'd be happy to take that conversation forward. So at this moment, I'd like to invite us all to just put our cameras on. We want to take a screenshot of this meeting, just to share with other people in our communities, and also to continue showing that, yes, these are the nurses on the ground, doing the thing, changing systems. Yes, I can see cameras coming on. Please don't feel shy, stand in front. I also need to find my window. Make sure that your smile is looking nice. Hannah is going to be helping us. I don't know how we're going to do this. Do we just smile, Hannah, and then you're going to take the screen?
Mohammed, do you have your hand up? Is that an old hand or?
Yes, I have my hand up, but it seems like we are hoping the question, but we have like 2 more questions, if you don't mind.
Oh.
But we'll let Hannah take the photos and we will answer the questions.
Yeah, okay.
The smile, Hannah, let us know when you're done.
Okay, last chance. If you want to be in the picture, turn your camera on.
Okay. Yes, we've got some more coming. Come on.
Thank you.
Oh, wonderful. Thank you so much, everyone.
Yes.
Go for it, Mohammed.
Go for it, Mohammed. Yes, sorry.
Well, thank you so much, Hannah, and thanks so much, Champion. I think we had like 2 questions, 2 breathing ones, so I'm going to bring one of them here, which is quite hot, which is like, the first one is, how does this report tackle workforce sustainability in African countries with an unstable workforce affected by conflict and economic challenges? I couldn't let that question go outside because it's breathing right now in the context in Africa with the economic crisis and ongoing conflict. So how would you like to respond to this question, Champion?
Sure. I think I'd already mentioned somewhere in the documentation that often the report presents the map. This is what's actually happening. So you'd get the numbers, you get the stats, but it then presents policy options. But then A report on its own cannot necessarily do anything unless the people on the ground, which will be our governments, our officers, and people like you, then take these policy recommendations and move them forward. So the report brings about, this is what's currently happening. These are the options that we need to take to move this forward, but that's it. That's where the report ends. And I think that was the essence of today's session, that great, it is a report, but what do we do about the report moving forward? We acknowledge the work that was done, and we acknowledge the disparities, especially in our continent, regions that are in conflicts, regions that are going through different areas. We get to know, but okay, in the DRC, this is what's happening. In Niger, this is what's happening. But then it's about moving these policy recommendations into practice, which is what the report could present, but then it's actions that come after that that becomes. So it was a very thoughtful question, and thank you for the person who asked.
All right, thank you so much, Champion. The last one, but maybe related to both of you, Aisha, Deborah, and Champion, it's about how can a nurse do a research that can be able to sell and get even funded. So it's basically about outlining the steps for nursing researches. So.
Who wants to answer that? Can I, just while we're thinking about who's going to answer that, can I also just say we will be launching the debate series following the launch of the State of the World's Nursing Report. And that will be a series, a programme of series debates around key elements of SoWN and the SDNM and implementation and key elements that will enable and facilitate action. So watch out for those coming your way across all our regions. Who was that question for myself and Champion?
Yes, please.
Champion, did you have any thoughts?
Well, it's very an interesting thought in that already this Africa Hub is a community. You are already people that are coming from different parts of the African continent. Lesson number one, if you're interested in doing research that attracts funding, if you want to do it on your own, you're wasting your time because that is not going to happen. There's an African saying, if you want to go fast, go alone. But if you want to move further, you go with a group. As part of the Nursing Now Challenge Africa Hub, perhaps think about getting a subcommittee or a subgroup that focuses on research. Develop that research question that could be answered, with collecting data across the multiple sites where you all are. And then that sort of project gets attention, gets attraction, because this is not just my little clinic and 5 people that work there, but this is data that is coming from 47 countries in Africa that are saying this is important. And therefore, when anyone who's a funder listens to, but we've got a group of people that can access data from 47 countries and they want to answer this research question, definitely that leads to funding, definitely that leads to interest. And having guidance from Prof. Aisha, who's been doing this for years, strengthens the quality of your research proposals, strengthens the quality of your grant applications in that particular space. My thinking, you are a group, already you are a superpower. The fact that you're from different countries across the region, that's a fantastic starting point. You've got leadership and guidance from people that have experienced, get the research questions sorted, and sort yourselves out in such a way that you become part of this bigger team. And then that often attracts more attention, because it's not one clinic in the middle of nowhere, but it is data that's coming from 47 countries of people answering the same question. That is most powerful and most valuable. So you are the answer to that question.
Yes, brilliant. And in the chat, actually, I've given you an example that we have here in Edinburgh, along with others that I've been involved with, called Global Surge. I've put the second link. The first link is about one of their COVID studies. They have this amazing platform, and I was involved in supporting the nurses, the surgical nurses, to establish a global surge nurse element. And they're doing exactly this, what Champion's talking about. They have this network of young surgeons who just could not get capacity building, could not be involved in papers, small data collection, small studies, not really at scaling capacity. So they have created this wonderful network that does exactly that, brings everyone together. They're all collecting their data across the world in different hospitals. We bring the data here into Edinburgh, into Redcap, and then we get to see outcomes at scale. And now if you go on there, you will find the nursing section. So, because I was like, why do the nurses not have their own global nurse search? So it took a while, but they are doing it now. I don't really do much there anymore. They are running with it, and they're actually doing a big piece of work around identifying doing like a Delphi study to see what the key research priorities are for perioperative nursing outcomes. So it is possible to do this, and I think, you know, we can absolutely come together because we have a structure here also. So I think it's something that a few of the regional hubs have been chatting about with me, and we're going to do after the launch, because we're quite busy obviously focusing on this at the minute, but that could be a big piece of work for us also. Hannah's thinking, we've just had a conversation, we say yes to everything.
Thank you so much for that. We actually have published a paper at the Africa Hub, I think 2 years ago. So it is indeed possible. So reach out to us with all your ideas, and we'd be happy to support. And with that note, thank you so much for being here. This has been so wonderful. Thank you, Professor Champion, Professor Aisha, Dr. Kari, for the wonderful surprise. And see you next time. Bye, guys.
Bye. Thank you, Zippy. Thank you, everyone. Thank you, Maureen. Thank you, Mohammed. Thank you, Champion, and everyone else. Thank you so much. Get waiting for that SoWN report.